Hi, Assalamualaikum. My name is Nazatu Farahidaya and I would like to present my research proposal on knowledge modeling for type 2 diabetic patient diet based on Commonkads knowledge engineering methodology. So in this video we will cover three topics. First, project introduction, literature review, and project methodology. For the project introduction, obesity and type 2 diabetes is a chronic disease that become a major problem in every developed country. A proper meal plan can help someone meet their daily nutrition needs, provide variety, and assist them lose weight if needed. So, an approach to develop a knowledge model using Commonkads to manage information and identify knowledge-intensive tasks for type 2 diabetic patient intake. For the problem statement, so due to the technology advance that we have seen, it is natural to get information and knowledge about illness and its medical treatment via the internet and search engine. The complexity of food can become confusing to the type 2 diabetic patient as there are terms and terminology that are hard to understand, and this impact in determining the type of food that can be consumed by them. As there is no standard in online food that able to help the patient, and sometimes it is only limited to certain language use and many more. Since the information about the complication is diverse, it is unstructured manner, the decision making process become more difficult and confusing. So then for the research question, so in this proposal we will have two research questions. So the first one is how to construct a knowledge model of type 2 diabetic patient diet. Second one, how to validate the knowledge model of type 2 diabetic patient diet. Then we will see the research objective. We will have three research objectives. The first one is to construct the knowledge model of type 2 diabetic patient diet. Second, to validate the knowledge model of type 2 diabetic patient diet. Third one, to develop a type 2 diabetic patient diet for food recommendation as a proof of concept. So for the scope, the scope of this model is focused on the type 2 diabetic patient such as the social. So the social is the age, the gender, the weight, the lifestyle. Diabetic related such as how many years or duration of the type 2, and diabetic related complication for non-diabetic related such as if the patient have other serious disease such as hypertension, kidney disease, and then psychiatric related such as depression, health related or personal issues, and healthcare cover from the type of the healthcare provider, or how many times they went to emergency. And then the other one is the type of food that the type 2 diabetic patient consume, such as what are the type of carbohydrate, protein, and fiber, and also fat. And then we will using the Commonkads knowledge engineering methodology. So for the significance, so this study will help to manage the type 2 diabetic food information by managing the knowledge of the food to help type 2 diabetic patients to have diversity of food recipe and help them in their diet. This technique and tool, which suggests the best diet according to the patient health situation and preference, help to support the system development. Then we will see the literature review. So in this literature review, we will focus on knowledge model method which are common cat method. So the finding you can see from this article, identifying beta thalassemia carrier using data mining approach. And so in this article, they use the common cat to classify the genotype of the individual with thalassemia who did not pass the clinical test. The suggested model finding revealed 12 thalassemia outcome linked to numerous factor components. Then we will see the knowledge model to to manage customer satisfaction based on claims. So in this, they use the Commonkads to manage the agent management from the training cost to improve the call handling. And then the other one is modeling the connection of brain region in children with autism using cellular neural network and electrophysiology analysis. So they use common cat model and help implement the CDSS prototype. And then the last one is prototyping the knowledge model for solving the problem of online cosmetic survey questionnaire through common cat methodology. So they use common cat in constructing the model, and then they use the task goal elicit related information and then analyze the model material. So they require the model from the cosmetic expert, marketing expert. So we will go through the project methodology. So the research framework is preliminary study, knowledge acquisition, knowledge design, knowledge validation, system development, system testing, and evaluation, and then the last one is documentation. For the first framework, to our goal is to get the first objective to construct the knowledge model of type 2 diabetic patient diet. So the first one is preliminary study, and then so in preliminary study, the activities is read and study about type 2 diabetic patient and knowledge about Commonkads. The source is online, expert journal, online database, lecture note and conference, and then the deliverable is project title, problem statement, objective, scope, significant, focus element, and information related to knowledge modeling. And then we go to the second one, knowledge acquisition. And the activity is collect data and knowledge about food for diabetic patient, for food from the food diary. The source is online, and then food journal. And then the deliverable is knowledge about food for the type 2 diabetic patient. We go to the third one. The third one is knowledge design. The activity is process and represent the knowledge. The source is website, online journal, and then article. The deliverable is knowledge about food for type 2 patient with the knowledge of common cat model design. Then we go to the knowledge modeling. So the knowledge modeling, the activity is design the architecture of the knowledge model using Commonkads. So the source is from website, supervisor, or an article, and the deliverable is arch- architecture of the model using the Commonkads model. Then we go to the second research framework for our second objective. So to validate the knowledge model of type 2 diabetic patient diet. So the the step is knowledge validation, and then the activity is validate the data with the expert for type 2 diabetic patient. The source is expert for the domain type 2 diabetic patient and supervisor, and the deliverable is knowledge validation result. Then we go to the last objective framework to develop a type 2 diabetic patient diet food recommendation as a proof of concept. So here we have three deliverable, three step system development. So activity system development, food recommendation as a proof of concept, develop a food recommendation as a proof of concept, source is knowledge modeling, and the deliverable is proof of concept. The second one is system testing and evaluation. So the activity is test the system to find the error and evaluate the system. Source supervisor, expert, and then the deliverable is evaluation result. And then the last one is documentation. So the activity write a full report, and then the deliverable is full report. So yeah, this is for my research proposal, and thank you for listening and have a good day. Bye.